Hello, my name is Andrew Nisbet. I'm an advanced practitioner in urgent and primary care, and as part of my duties for the last year, I've been undertaking telephone and video consultations. I hope you find the following presentation useful as you start your training in this role. In response to the coronavirus pandemic, Scottish Ambulance Service advanced practitioners in urgent and primary care are working differently. Staff now use telephone and video consultations to ensure patients get seen by the right person at the right time. Shared decision making is used to agree the best pathway to meet patient needs. This may be an ambulance attending, but examples of alternative pathways include referral to patient's own GP, NHS 24, mental health teams, coronavirus hubs, district nurses, hospital at home service, falls teams, or minor injury units. Self-care advice may often be suitable, but if hospital attendance is indicated, we will assess the safest and most appropriate mode of transport. Before starting a consultation, it is best practice to establish some background information. This should only take a few minutes. Check case notes to establish what the initial reason for the call was. Review patient notes available on their ECS. Review their current medications. For example, if the call is for a head injury and the patient is prescribed warfarin or another anticoagulant medication, your advice and plan will need to reflect this. Does the patient have a key information summary? This may include information regarding care plans or a do not attempt CPR instruction. Have a pen and notepad to hand. Although you can add notes to the C3 system, it's sometimes necessary to copy down information quickly. If you do copy paper notes down, please ensure that you comply with GDPR data regulations and ensure any notes are shredded and disposed of in secure waste. It's good to have some structure when you're starting a telephone consultation. Try to use a standard introduction. Here's an example of one below. Hello, my name is Andrew. I'm an advanced practitioner with the Scottish Ambulance Service. I'm phoning to try and assist in getting the right care for you today. I then go on to confirm who am I speaking to? Is it the patient or a relative or a bystander? Where you are they at home? Are they at a relative's address? I'd confirm the patient's name, their date of birth, and who their GP was. I'd then ask a safety question. Have you or can the caller ask the patient had a high temperature or a new continuous cough or a loss of sense of smell or taste? If they answered yes, then I would consider the possibility of COVID-19. Patient safety must always be your top priority. If during telephone or video consultation you establish the patient has an emergency presentation that requires an ambulance attendance, please arrange this with the appropriate response level as soon as possible. The diagram shows the different response levels used by the Scottish Ambulance Service. It is really important to have some structure to your consultation. Undertake your consultation and record in the notes section of C3 using the following template. Don't worry, you will have plenty of opportunity to practice this during your face-to-face training for telephone and video consultation. You can break a consultation down into 4 sections. This is known as an S-bar. You may have heard of that before. Firstly, we consider the situation. What is the reason for the 999 call? Then we can ask about background. This would include patient's previous medical history, any allergies, any medications, and their social history. We can then move on to assessment. So what is your assessment of the current situation? What do we think is happening today? We can then move on to a recommendation. Agree an outcome with the caller. This may be an ambulance attending, or referral to an alternative pathway, or self-care advice. Deciding if telephone consultation is appropriate, we really need to consider a few key elements. Is the diagnosis clear? Can we be certain there is no red flags? Is the patient in a place of safety? Can we be sure the patient is not intoxicated through alcohol or drugs, making a discharge difficult? Is the caller willing to accept reassurance, advice, or onward referral to a more appropriate service? During the initial telephone conversation, decide if using video will add to the consultation. Video consultation can be extremely useful for assessing minor injuries, rashes, breathing problems, and primary survey positive patients where red flag symptoms may have been missed or not obvious. The Scottish Ambulance Service currently use the Good Sam app. Full details of this can be found in the Advanced Practitioner Consultation Pack. One thing to remember, always gain consent prior to initiating a video call. Telephone and video consultation offers a safe and effective method of assessing the needs of a patient. It can, however, be challenging both for the staff member who may be new to remote consultation and also for the 999 caller who may have an expectation that an ambulance would be automatically dispatched. When a call is referred for additional consultation, the 999 caller is advised that they will be called back and offered additional support, so they should be expecting a call from you. The following slide offers some helpful phrases to adopt during a consultation. We often receive common questions when doing telephone or video consultation. A caller may often ask, "Why is an ambulance not being sent?" I always try and answer that the ambulance service is having to operate very differently due to COVID-19 and the additional pressures this is causing. I will do my best to make sure we get the right care for you today. If an ambulance is needed, I will arrange one, but a safer and more appropriate pathway may be possible. I will do my best to help you today. Please bear with me. A caller may also ask, "How long will the ambulance take?" I always try and answer, it is never possible to provide a time for your ambulance arriving today due to ever-changing demand in your area. It will, however, be with you as soon as possible. And if anything gets worse before the ambulance arrives, please phone straight back on 999 and we will offer you additional support. Safety netting is the final and perhaps most important part of any consultation. Follow a three-step approach. What I expect to happen. Give self-care advice regarding this. What happens if I am wrong? Discuss any red flags for the patient, caller, or relative to be aware of. And what you, the patient, needs to do if these are happening, if these occur. What worsening case advice would you give? So that might be to phone back on 999, or to contact a GP, or to contact 111. As we near the end of a consultation, it is really important to summarise the consultation's main points and ask the patient if they have any questions or if there's anything they would like you to explain again. Allow time for them to think before they answer. The Advanced Practitioner Consultation Pack is a SWAY document. This is an online document that is regularly updated with the latest referral pathways and contact numbers for staff. An online version can be downloaded by clicking the link below. Thank you for taking time to look at this presentation today. Below are links to further reading which you may find helpful when undertaking telephone and video consultation.